Okay, sir. Good afternoon. So, before anything else, I'd like to formally introduce myself first. So, my name is Pamela Kathleen Sancho, and I will be your student nurse for today. So, for verification purposes po, may I have your full name, please?
My name is Dindo Santos Sancho,
Okay. How about your birthday
May 18, 1972,
and your age?
50 years old.
Okay, so thank you for providing that information. So, how would you like me to address you po?
Mr. Sancho,
Okay po, so Mr. Sancho, before we start, just to set proper expectations, I'll be explaining first the procedure that we will be doing. So for today, we will be conducting a thorax and lungs assessment. And for me to be able to assess that, I will be touching certain areas of your body, specifically the chest and back area. So are you comfortable with that, Mr. Sancho?
yes,
Okay, so that by the end of our assessment, we will be able to identify any abnormal findings regarding with your thorax and lungs. Okay, so rest assured, Mr. Sancho, that all of the documents and findings will be kept confidential and can only be shared with the healthcare team professionals that is involved with you. So do you have any questions or clarifications for me?
none.
Okay, so before we start with the procedure, I would like to ask some questions. So sir, would you like to do any personal things first before we proceed with our assessment?
None.
Okay, so for the next part of the assessment, I will be conducting a hand hygiene, but since there is no available sink in the area, I will be just using the alcohol to disinfect my hands. Okay, so Mr. Sancho, here is your patient gown. So I'd like you to change into the patient gown so that we will be able to assess you properly and for you to be comfortable throughout the procedure, okay? So I will be closing the drapes now for us to have our privacy and for the patient to be comfortable. So I already told the patient to change into the patient gown. I already performed my hand hygiene and I provided privacy for the patient. Okay, so for the equipments that we will be needing for our thorax and lungs assessment, we have here our clean gloves, skin marker, a centimeter ruler, pen light, alcohol, and of course our stethoscope. Okay, so for the next part of the assessment, I will be inspecting the posterior thorax of the patient. So for the first part, I will be inspecting for the structure, symmetry, and the breathing pattern of the patient to see if there are any irregularities or shortness of breath. So Mr. Sancho, can you please sit straight and then put your hands on your lap and then inhale and exhale for me. Okay, inhale. Then, okay, thank you for that, Mr. Sancho. So, for the next part of the assessment, I will be palpating the posterior thorax of the patient to see if there are any tenderness or pain. So, allow me to wear my gloves first. Okay, so I will be now palpating the posterior thorax of the patient. So allow me to touch you po. Okay, thank you for that, Mr. Sancho. Okay, as I was observing, I observed that the spinal cord of the patient is symmetrical. I also don't observe any signs of kyphosis, scoliosis, lordosis, or any misalignment in the spinal cord of the patient. I also don't observe any lesions when I palpate the back of the patient. When I told the patient the creed, I also observed that he was using his shoulder as his accessory muscle. And when I asked the patient if he feel any tenderness or pain when I palpate his back, the patient said that he hasn't feel any pain or tenderness. Okay, so for the next part of this assessment, I will be palpating now for the crepitus to feel if there are any crackle sounds. So sir, can you please inhale, then exhale, inhale, then exhale, inhale, then exhale, inhale, then exhale. Okay, so for the next part of the assessment, I will be now palpating for the tactile fremitus. So for the tactile fremitus, sir, can you please say the word 99 when you hear the ulnar parts of my hand touch your back? So I will be using the ulnar parts of my hands for this assessment. So can you please say the word 99, sir?
99, 99, 99, 99, 99, 99.
Okay, so thank you for that, Mr. Sancho. For the fremitus, I observed that it was symmetric, and when the patient says the word 99, I can feel the vibrations. So for the next part of the assessment, I will be conducting a chest expansion. So for me to be able to do that, I will use my thumb. So I will put my thumb in the T9 or T10 of the spinal cord of the patient, and I will use my skin marker here and the centimeter ruler. Okay, sir, so when you feel my thumb on your back, can you please inhale and exhale? One moment. So there should be a skin fold in the back of the patient for me to be able to observe my thumb when the patient inhales. So sir, can you please inhale? Okay, then hold your breath for me. Okay, so inhale, sir. So can you please inhale again and hold your breath for me? One moment. Okay, and exhale. So I will be measuring now the marks. So for this, it is 4 centimeters. Okay, so for the next part of the assessment, I will be percussing the back of the patient to hear for any abnormal sounds. But first, let me just remove my gloves. Okay, so I will now percuss the back of the patient. Okay, so I have observed the resonance, the dullness, and the flatness as I percuss the back of the patient. Okay, so for the next part of the assessment, I will be percussing and performing the diaphragmatic excursion. So for this, I will be needing again my centimeter ruler and the skin marker. So I will be percussing the back of the patient now. So sir, can you please inhale, then exhale, then inhale, then hold your breath for me. So for this part, I will be percussing the back of the patient, and we're looking for resonance to dull. Okay sir, exhale now. Okay, so here, I will mark here. Okay sir, can you please inhale, then hold your breath again for me. And to the other side as well, from resonance to dull. Okay, sir, exhale. The ulnar here. Okay, so for the next part, I will still percussing the back of the patient, but now we're looking from dull to resonance. So, sir, can you please inhale, then exhale, then hold your breath for me. Okay. Okay, sir, you can inhale now. And to the other side as well. Okay, sir, can you please inhale, then exhale, then hold your breath for me. Okay, sir, you can breathe now. Okay, so I will be measuring now the markers that I put here. Okay, and for that, it is 3 centimeters. Okay, so for the next part of the assessment, I will be auscultating the back of the patient for the breathe sound to see if there are any abnormal sounds. So I will be using the bell of my stethoscope. Okay, sir, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, then exhale, inhale, then exhale. So I don't hear any abnormal sounds when the patient is inhaling and exhaling. Okay, so for the next part of the assessment, I will be auscultating for the voice sounds of the patient. So we will be doing a 3 parts. So for the first part, for the bronchophony, sir, can you please say the word 99 when you hear the bell, when you feel the bell of my stethoscope on your back? Okay, sir, so can you please say the word 99?
99, 99, 99, 99, 99, 99.
Okay, so I observed that when the patient says the word 99, I can hear it clearly, and that is an indication that it is normal. So for the next part of the assessment, I will be auscultating for the egophony. So sir, can you please say the letter E when you feel the bell of my diaphragm, when you feel the bell of my stethoscope on your back? Okay.
E, 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 E.
Okay, so for the egophony, I can hear clearly the letter E when the patient says the letter E instead of the letter A, which is this is an indication that it is normal. And for the last part of the assessment, I will be I will be auscultating for the whispered pectoriloquy. So sir, can you please just whisper the numbers 1 to 3 when you feel the bell of my stethoscope on your back? Okay.
1, 2, 3.
Just whisper, sir. Okay, so for this part of the assessment, I observed that the patient is saying something, but I can't hear it, so that is an indication that it is normal. So that's it for the posterior thorax of the patient. So let's now proceed to the anterior thorax of the patient. Okay, so let's now proceed to the anterior thorax of the patient. So for the first part of the assessment, I will be inspecting for the shape and configuration and the symmetry of the trachea and sternum of the patient. I will also be observing the breathing pattern of the patient if there are any irregularities or shortness of breath. So, sir, can you please sit straight? Okay, and then inhale and exhale for me. Okay. Okay, so as I was observing, I don't see any irregularities or shortness of breath, and it is symmetrical. Okay, so for the next part of the assessment, I will be palpating again the anterior thorax of the patient to see if there are any tenderness or pain. So allow me to wear my gloves again. Okay, sir. So, allow me to touch you po. Okay. Do you feel any tenderness or pain?
None.
Okay.
None. 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 None.
Okay. So, the patient said that he hasn't feel any tenderness or pain when I was palpating his chest area. Okay, so, for the next part of the assessment, I will be palpating again the anterior thorax of the patient for the crepitus to see if there are any crackle sounds. Okay, allow me to touch you again, sir. Okay, so for the next part of the assessment, I will be palpating again the anterior thorax of the patient for the tactile fremitus. So I will be using again the ulnar parts of my hand. So sir, can you please say the word again, 99, when you feel the ulnar part of my hands on your chest area?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so when the patient says the word 99, I feel the vibrations and it was normal. Okay, so for the next part of the assessment, I will be palpating again for the chest expansion. So I will be using my thumbs and place it here. And there should be a skin fold right here so that when the patient inhale and exhale, I can see the movement of my thumbs. So sir, can you please inhale for me and hold your breath. Okay, then exhale. Then can you please inhale again? Then hold your breath for me. Okay. Then exhale. Okay, so I will be measuring now the markers that I put here. So it's 3 centimeters. Okay, so for the next part of the assessment, I will be percussing the anterior thorax of the patient to observe for any abnormal sounds. But let me just remove my gloves. Okay, so allow me to touch you po. So I will percuss now the anterior thorax of the patient. So breathe normally, sir. Okay, so I observe the resonance, dullness, and flatness in the anterior thorax of the patient. Okay, so for the next part of the assessment, I will auscultating the anterior thorax of the patient to see if there are any adventitious or abnormal sounds. So I will be using the bell of my stethoscope. Inhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, so I don't observe any adventitious or abnormal sounds. So for the next part of the assessment, I will be auscultating again the anterior thorax of the patient for the voice sound. So there will be also a 3 parts. So for the first part of the assessment, it would be the bronchophony. So sir, can you please say the word 99 again when you feel the bell of my stethoscope in your chest area?
99, 99, 99, 99, 99, 99.
Okay, so just like in the posterior thorax of the patient, when the patient says the word 99, I can hear it clearly. So this is an indication that it is normal. So for the next part of the assessment, I will be auscultating for the egophony. So sir, can you please say the letter E when you feel the bell of my stethoscope in your chest area?
E, 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 E,
Okay, so for this part, just like in the posterior thorax of the patient, I can hear clearly the patient says the letter E instead of the letter A, which is an indication that it is normal. So for the last part of the assessment, I will be auscultating again the anterior thorax of the patient for the whispered pictorial liquid. So sir, can you please whisper the numbers 1, 2, 3 when you feel the bell of my stethoscope in your chest area? Okay, so just like in the posterior thorax of the patient, I can see the patient is saying 1, 2, 3. He is whispering something, but I can hear it in the stethoscope, which is an indication that it is normal. Okay, sir, so that's it for our thorax and lungs assessment. So I already gathered all of the information that I needed for today. So I'll just document it and put it into the chart, patient's chart. So kindly wait, and I'll be recommending you to our specialist doctor who can give you a proper advisement regarding your health concern. So aside from this, sir, do you have any questions or clarifications for me?
None.
Okay, sir. So thank you for your cooperation, time, and effort. So I will be cleaning down all the equipment that I use for this assessment. So sir, you can wear your t-shirt now. So that's it for our thorax and lungs assessment. So once again, my name is Pamela Catlinam Sancho and I'm from group 28.